Hello there, welcome to the clinic. We're going to do an in-depth dermatological examination of the skin of the face, including that of the ears and the neck, but not the scalp tonight. I've mapped out all the areas on my diagram here. So we'll focus firstly on the forehead, and I'll have a look at your temples, left and right, of course the ears, and most importantly the orbits surrounding skin, as well as that of the lids and lashes, which is a common site for many types of lesions. Nose, nasally, cheeks, and then the mouth, lips, chin, and finishing off with some palpations around the neck. I'm going to show you briefly my poster. Some of the common skin disorders we are focusing on there. Just ignore the light reflections. So we have wrinkles, dry skin, vitiligo, types of acne, blackheads, whiteheads, pustules, but to name a few there. So don't worry, we're really going to cover all bases. A simple overview of the model of the skin there. You can see your various sebaceous glands, your lash follicles, vascular networks, some adipose tissue, epidermis, dermis, and some of the musculature attached to said glands and follicles there. So that's a little overview of the skin using my special model. Right, so first of all, and it's only very briefly, just a few questions. My pen is here. So, any history of any skin issues, conditions? Have you ever been diagnosed with anything before? Do you have any allergies? Are you taking any medication? And do you use any products on your skin? So just a simple moisturiser, okay. Who produces this moisturiser, please? Give me the brand name. Would you say you have dry, normal or oily skin? Excellent. Is there any family history of any types of skin cancers, including that of the lids, which encompasses the carcinomas. Right, so face map, poster, questions. Firstly, before inspecting, and I'll annotate on our face there, if we see any lesions, I'm going to take some pH samples of the skin, looking for a value slightly acidic, just a couple of units below a pH neutral. Okay, just let me place that strip there, and I'm just going to slide it to there, thank you. Give that a moment. And one just here, please. And if I can get the final strip. One just of your left cheek, please. So we'll analyse those samples shortly. Now, let's begin. Just look towards me, please. I'm just checking your natural posture in the primary position there. So please don't hunch, don't put the head back, just a natural position. No abnormalities detected there. Right. There is going to be light involved. I'll try not to shine it directly into the eyes, but please excuse me if you find it a little bit bright. Right, I'm just going to look through this illuminated magnifier, checking your forehead. Going to come very close to the scalp line there. Alright, good. A couple of chickenpox marks, similar to mine. scars, should I say. It's important that I do feel all the areas of the face, please. Please report any pain or tenderness. So now, lesions, just a couple of scars. Relatively normal temperature to the touch. Now for the temples, just a little bit of light and a little bit of palpating. Just a small area to cover. Okay, no signs of any vessel engorgement. I'll feel the temples. Again, just report any pain or tenderness, please. Excellent. I'm going to move on to one of my favourite areas now, the orbits, so the surrounding skin. I'm going to be looking for any nevi, any skin tags, any milia, blackheads, wrinkles, carcinomas, hordeolums, chalazions, or meibomian gland dysfunction. For this, I'm going to switch to a much softer illuminated magnificator. There we go. So brightness isn't going to be an issue for you. I'm going to sweep around the zones now. Okay, now just look straight out towards me through the magnifier. Just blink normally and try not to close your eyes. Okay, just ignore any reflections from the room lighting, please. Okay, on the lower lid there's a little bit of a pigmented lesion, but it looks flat. It looks avascular. Have you noticed any pain or felt any pain there, or saw any bleeding? Okay, have you had any loss of eyelashes in that area? Marvellous. Okay, I'm switching to the inner part. There's a hint of xanthelasma just on the right bridge there. Okay. pigmented lesion, flat, non-sinister. Certainly doesn't appear to have the characteristics or behaviour of carcinoma. Right, your left orbit, please. Lovely, thank you. You may have the upper lid, a capped meibomian gland. Do you have any history of dry eyes? Any rosacea? Or what about eczema? That's fine, excellent. Okay. And the lower puncture is open there, lovely. I think I'm going to need a little bit more illumination. Sorry, a little bit more magnification here. Going to hone in again on these meibomian glands and tear ducts. And for the left, please. So the orbit's relatively fine, it's just those areas on the eyelids, but it's nothing sinister, I might add. That is the news we all want. Okay, let's have a feel of the orbits now. Sometimes you can have a blocked meibomian gland, a lesion, and it's not always visible. You're more likely to feel it and see it. So what did you say about the left blocked meibomian gland? So have a little feel of that. Lesion, gland, a little bit of xanthelasma. It's not going to stay on, okay. Okay, you can keep your eyes open. I'm not going to touch the globe. In fact, let's do it individually there. Okay, things feel flat on the right. And for the left, please. Now back to the upper, please. I think you have a very small, firm lesion. Now that is essentially a bit of a hard mass where the meibomian gland that produces the lipid portion of the tears was a little bit blocked. It's idiopathic in nature for most. I just want you to come back if this grows in any way, and we can refer if necessary, but it's very small. In fact, I have a little scale on here. Let me just take a measurement of that on the upper left, please. It is no more than 1.5 mil. Okay, let's move on to the cheeks. Just a quick scan, please. Just open and close the mouth a little bit. And that's that, relax. And feel off the lymph nodes here. Don't worry, everything's fine there. I just want a better view of things. Okay, lips and mouth, please. Chin. Any history of cold sores on the lips? That's good. Okay, just open your mouth a second, please. And relax. Okay, and for the nose, let's just bring the light down from this angle. Just tilt that back, please, a little bit. Excellent, thank you. So that covers most of the face. Finish off with the neck. So your annotations thus far. Right, let's have a feel of your neck, please. Okay, I'm just going to place my finger and thumb on the thyroid gland there. That way, it might feel a bit strange, but it won't hurt. Okay, just swallow, please. Excellent. everything is looking fantastic. Just a few little minor issues around the lids. The pigment patch, nothing to worry about. Neither is the meibomian gland. The xanthelasma may indicate possibly too much cholesterol in the blood, and they form these little deposits around these type of areas here. So just pay close attention to your diet. You should be taking in the good fats, reducing the bad fats. Nothing wrong with good fats in the diet, such as those natural oils and anything that comes from our nuts. Yes, oily fish is a good one. Good source. Mackerel, salmon, pilchards. Oh, we need to check your ears. I almost forgot. Turn slightly this way, please. Excellent. So feel of those ears. Excellent. I'm going to finish off with some gentle, relaxing tapping on the face, just very quickly. Most of my patients find this very soothing and relaxing indeed. And then we are, there's your examination completed. It's very good news. Now, I usually advise to be seen again in 2 years, routinely, but obviously if you have any concerns about your skin, if anything appears that you're not sure of, or you experience any pain or tenderness in any areas, just book in and I'll be happy to see you. So, thank you for coming in, and I'll see you, all being well, in 2 years.